Can testosterone replacement therapy improve muscle building and fat loss? Yes. Testosterone, we use testosterone a lot of times for the mood and energy benefits. And a positive side effect is if you're working out and working on fat loss, it's going to augment those results. If you're doing resistance training 3 to 4 days a week, it's going to help you improve muscle mass. It's going to help with muscle recovery. It's going to help with fat loss as you're putting in the work for it. A lot of times it won't cause tons of fat loss if you're not working towards a calorie deficit, if you're not working on improving your activity, if you're not focusing on your diet. You won't see much fat loss, if any, but the work you put into it is only going to augment it. In testosterone replacement therapy, is this the same testosterone that bodybuilders are using? Yes, it's just much lower controlled doses. I will say testosterone replacement therapy doses range from 80 milligrams a week to 160, 200 milligrams a week. Bodybuilders are going to be doing 500 to 1,000 milligrams a week, plus multiple other compounds. And what I mean by that are other anabolic steroids, injectable orals. So they are on a whole different level. That is a question I get a lot. You won't have the negative outcomes that bodybuilders have, and of the sky high estrogen, of the cardiomegaly, meaning your heart get bigger, the roid rage, that kind of stuff. That's not typically seen in testosterone replacement therapy doses. In fact, a lot of times mood improves. Sometimes a guy with low testosterone will be moody and irritable. People who are worried about roid rage, but he'll actually have improved mood as he feels better and is able to tackle his problems and situations better because he has better energy and just feels better compared when he was in a low testosterone state. The roid rage is completely different, as some of those compounds can cross the blood-brain barrier and have a whole other host of negative side effects as well. What if you have a super demanding job that requires a lot of cognitive input just consistently throughout the day? Will testosterone improve this? I would say yes, and that is a guy that does need elevated, optimal levels of testosterone. I mean, I've heard testosterone kind of coined as the CEO hormone, meaning it gives you that initiative, that drive to be in a CEO-like position. So if you do have a high stress demanding cognitive position, then I would want you to be optimal so that you are functioning at your highest capacity. Do guys on TRT need an estrogen blocker? I have 0 guys on estrogen blockers in the practice. This has been historically part of a testosterone regimen. A lot of it comes from the old bodybuilding days on, if you're on testosterone, you need to block your estrogen or you're going to grow man boobs and cry at any little thing because you're emotional. Testosterone replacement therapy doses do not need aromatase inhibitors to block the estrogen. Estrogen is an intracrine hormone, which means the conversion happens in the tissue. And that's where the aromatase inhibitors, the estrogen blockers, block that. However, estrogen is beneficial to guys in a lot of ways. It helps protect cardiovascular system. It is largely driver in your mood and libido, and it protects your bones. And honestly, it's probably 50 to 60% of the positive benefits of testosterone come with the elevated estrogen levels. And so I don't even monitor estrogen levels or check them because every guy focuses too much on them and thinks it needs to be blocked. And if you block it, then you can essentially turn into a menopausal female. That's kind of dramatic. But if you block it too much, you're going to get joint pain. You're going to get moodiness. You're going to worsen your bone health. You lose the cardiovascular protection of testosterone. And we do not want that. We want those benefits. And so I want you to ride a little high. And I have had guys come and say, well, I was watching the Sarah McLachlan commercial and I cried, and that's not like me. It's like, bro, you had an emotional response. That's a good thing. You don't have to worry about crying. That's not because you're on testosterone and have an elevated estrogen level. It's just because you had an emotional response, and that's a good thing.
Is that a symptom of like lowering stress in some way because of testosterone's helping manage some of that improved mood? Maybe they can access those other emotions will just more easily reversible.
Exactly. You have low stress. So you don't have to just repress everything. Like as a guy, sometimes you're just you're putting everything on the back burner so that you can just get your job done. Or if you feel a little better, you can actually take on things. You may let that guard down a little bit. And then you have that emotional response. No, I don't want you crying at every little thing, but it is normal for most people to cry at the Sarah McLachlan dog video, so it's just that's a if it's situation appropriate, then we're still fine. If you've never done that, it may just let you feel good enough to let your guard down a little bit to do that. If you block the estrogen, that's whenever the guys will have erectile difficulties. They'll be moody again. They'll have joint pain and just don't feel as good. And then it's kind of hard getting them off of it. Once you stop it, you feel worse. And so they think that they need it again because they feel bad coming off of it. So they start it back and they feel a little better. But then, the root cause is that your estrogen's too low or the medication itself, because it's, again, then another medication with its own set of side effects and everything you have to worry about. So you've made an appointment with Live Oak and you're coming in for a testosterone evaluation. What can you expect? So we'll get you in, we're gonna get a set of vitals. We get a body scan, on everybody. We're gonna draw a set of labs because even if your primary doctor has drawn labs, most of the time it does not have the specific markers I'm looking for to get an adequate testosterone evaluation. And then I'm gonna get you back. We're gonna have a pretty thorough questionnaire just to get to know you as a person. I kind of wanna know the lifestyle that we're working with. What do you do for work? What are your hobbies? What's your sleep like? Do you have any problems going to sleep, staying asleep? Do we need to consider getting a sleep study? Are you married? Do you have kids? Do we need to worry about fertility? So I get a pretty detailed, comprehensive questionnaire. That was redundant. I get a pretty detailed questionnaire at the beginning so I can just kind of know you, and we have that in our system. Additionally, I'm going to get you to fill out what's called the ATOM questionnaire, and that is a validated questionnaire that shows low testosterone symptoms, and that encompasses your energy, drive, motivation, brain fog, libido, erectile quality, mood, and that kind of things. And so we can somewhat quantify how low you are on a testosterone score, because even if your levels are normal, we may still start you on testosterone based off your symptoms. If we're looking for symptom resolution, I'm not always going to hang my hat on a specific number. We have the initial appointment where we talk with you, evaluate anything that needs to be evaluated, and then we'll go over your labs. I like to get a good comprehensive set of labs at the beginning so that we're just not hyper-focused on testosterone and we miss something else that is the driving factor. So at baseline, I'm going to get a CBC, which is a complete blood count. So I can look at your red blood cells, your white blood cells, everything. Make sure your blood's not too thick to begin with. And sometimes that lets me know, hey, we need to get a sleep study off the bat. Or you smoke and we need to talk about smoking cessation. That can also let me know if you're iron deficient or anything in that regards that we need to address, because that can cause a lot of the same fatigue as well. We'll get a complete metabolic panel to look at kidneys, liver, electrolytes, make sure that looks okay. We're going to check your thyroid. Low thyroid has a lot of the same symptoms as low testosterone, and I don't want to be fixing testosterone when it is your thyroid that's really driving your symptoms. We're going to check a vitamin D level. That can affect mood, energy levels, and is a precursor to a lot of hormones as well. So we want to make sure you have an optimal vitamin D. We're going to check hemoglobin A1C to see what your 3-month average of glucose is. Make sure you're not pre-diabetic, diabetic. We'll check fasting insulin, some people, for another marker of metabolic health. We check a traditional cholesterol panel because I want to baseline in that and see what kind of changes we need to do in that regard, and if we need to have the cholesterol management discussion or not. I get luteinizing hormone and follicle stimulating hormones levels so I can see how well your pituitary is talking to your testicles. I get a baseline prostate level. PSAs are, kind of controversial on when we need to do them, but I'm going to get them every baseline before we start testosterone. I get what's called a prolactin. Prolactin is typically, what stimulates breast milk in a lactating female, but in guys, it can affect orgasms and erectile quality. Additionally, if you have super low testosterone and you have a high prolactin, we're going to need to get an MRI to make sure you don't have what's called a pituitary adenoma or any type of pituitary mass. And then, of course, I'm going to check a testosterone level with a sex hormone binding globulin. The testosterone level is the one that you always hear that the range is, 280 to 900. It's that bigger number. But then we use the sex hormone binding globulin to calculate your free testosterone. The free testosterone is what is used by your tissues and is really where I follow for symptom resolution. Levels of 20 to 30 are where guys typically feel the best with minimal adverse effects. And typically, if their free testosterone gets above 35, 40 is whenever they start having the adverse, too high of testosterone symptoms, and that will be decreasing down. Sex hormone binding globulin is a binding protein, and that is how much of that total testosterone is bound up to be transported through the body. Some guys will have a really high sex hormone binding globulin, and that just binds up a lot of that total testosterone. And they may have a low free testosterone because it's all bound up and the body's not using it in the tissues like it needs to be. So even though a guy may have a mid-range testosterone level, it's not uncommon for me to put them on testosterone if one, they're symptomatic, and two, they have a low free testosterone. And then say testosterone is started. So we'll talk about if you want to do a cream or injection. Then we get you back in 8 weeks to recheck your labs. We're going to recheck your blood count to make sure blood's not too thick. We're going to recheck kidneys, liver, electrolytes, lipids, hemoglobin A1C for diabetes, prostate, make sure that hasn't gone up. And then testosterone, sex hormone binding globulin again to see what kind of response you're getting. I will put you at a dose to where I think you'll probably have symptom resolution, but sometimes we have to increase or decrease the dose. And we will see that at 8 weeks, we can make adjustments, and then we'll recheck every 3 months until we get you dialed in to where you feel the best. So now we decide to start testosterone replacement therapy. The two best ways to do that is through injections and creams. Injections are 2 to 3 times a week, depending on your sex hormone binding globulin, typically twice a week, and they're injected into your muscle, so shoulder, thigh, butt, hip. You can even go into subcutaneous tissue, like your abdomen, the fatty tissue. Testosterone is oil-based, and sometimes you'll get painful nodules if you go into the fatty tissue, so then I'll get you to switch you to muscle. Injections are great. It allows us to do quick adjustments if needed. If we need to change dosing or frequency, it's easy. We can do it with the next injection. And you can get good, consistent, stable levels all the time since the esters have such long half-lives. Cream is another option, and I do have guys get good results from cream. Cream does improve DHT levels, which can sometimes be a little better for libido. With elevated DHT, some have said there's an increased risk for the hair loss and thinning if you're genetically prone, so that's another variable to be aware of. But I get you to apply the cream to your scrotum 1 to 2 times a day. Scrotum specifically because the skin is thin, there's a lot of vessels. That's a way to get the best levels in a topical formulation of testosterone. And it also limits axonal transference to women and children, meaning that if you're not accidentally touched on your scrotum very much, and so there's less chance of you accidentally having that cream spread to a woman or child, someone who doesn't need elevated levels of testosterone. I recommend no sex or showering 4 hours after application, again, to limit transference. If you showered off right after you did it, it is oil-based. It could leave a small film at the bottom of the shower floor that if they came in right after you and stepped in it, it could be absorbed through the feet. So that's something else to be aware of with creams. Injections sound intimidating, but that's probably what we have the most of our guys on. And it gets easy. It gets pretty routine. And we can work with you on self-injection at the office until you're comfortable doing it at your house. So starting testosterone, how quick can we expect results, feeling better, that kind of stuff? I have some guys who get kind of this honeymoon period and they feel absolutely amazing in the first week or two. But honestly, I tell guys really it's 4 to 6 weeks before you really start seeing the improvements. And they're kind of subtle, meaning you'll kind of look back and you'll be like, man, I am sleeping a little better. And I am coming home and I'm a little bit more busy in the evenings. I don't seem to be as moody with my wife. And, sometimes that takes to kick in. And then typically you get even increasing results, like typically 3 months, you feel better than what you did at 8 weeks. 6 months, you feel better than what you did at 3 months. Typically, for about a year, you seem to get only improving benefits, especially if you're putting in the work to kind of clean up the lifestyle at the same time in terms of nutrition, sleep, exercise, mental health, and that kind of thing as well. What if I'm not getting the results from testosterone that I was looking to get out of it? There's a few things we look at. One, have you cleaned up any of your lifestyle? Have you cut back on alcohol? Are you prioritizing sleep? Have you developed an exercise regimen? Do we need to get a sleep study? Sleep apnea can mimic a lot of the same signs of testosterone. Do we notice any type of thyroid dysfunction, low vitamin D, possible iron deficiency in your labs? Those are all kind of secondary things that I'm thinking about. If a guy comes to me and he's not getting the benefits after 3 to 6 months, we've got to dig deeper a little bit. Sometimes it is still just, life is stressful and we got to work on improving mental health and everything. Having an optimal baseline of testosterone in the background sets good tone for all these things to be improved upon, but doesn't always fix it if your lifestyle is still crap. If you're drinking 6 to 8 beers a night, you're probably not going to get much benefit out of testosterone. If you get 3 to 4 hours of sleep and you're not trying to catch up on it at all and you're still just blowing and going, you're not going to feel good until we can get you more to 7 to 9 hours of sleep. If you're sleeping 7 to 9 hours and you're snoring real loud, do we need to get you a sleep study to make sure you're not suffocating a third of your life? So there are various things that we will dig into if you're not getting the outcomes that you're looking for. We can try to change dose or frequency and that kind of stuff, but what you put into it, you also get out of it. Meaning if you're putting in the work and putting in changes, typically testosterone only augments those responses and you'll get even more out of it from what you were putting into it. Common side effects with GLP-1 medications like the semaglutide, tirzepatide. What we commonly hear are nausea, abdominal bloating, constipation, sometimes fatigue and headache. For the fatigue and headache, there's 2 things that I think about the most when I hear those. One is, are you getting enough fluids and electrolytes? Also enough food at the same time. Sometimes if you come in and you've been eating 3,000 to 4,000 calories a day, and now we started this med and you're eating 800 to 1,000, your body is not going to want to do much. And so from a fatigue standpoint, I want you to make sure you're getting in at least your protein so that we can make sure you're getting enough nutrition to keep you going throughout the day. For the electrolytes, make sure you're getting 80 to 100 ounces of water a day and put some electrolytes in there. A lot of times that'll help offset the headaches and can improve the fatigue as well. Constipation is pretty common, honestly. And so make sure you're getting enough fiber and fluids at baseline. Again, 80 to 100 ounces of fluids, 20 to 30 grams of fiber a day, preferably through food choices. But if you need fiber supplementation, then by all means do. If you're prone to constipation, start Metamucil daily as well, because that'll help keep you regular. And it's something that you can take every day and your body doesn't get dependent on it or anything. For the abdominal bloating, I like people to eat so they're about 80% full. The last 20% will come, especially if you're able to push the food away, get them to go do something. By the time you come back, you'll realize you're 100% full. But if you eat a big, heavy, greasy meal to 100% full on these, every meal is going to feel like Thanksgiving. It's going to sit right here. It's going to take all day to digest. It's going to worsen reflux, can worsen nausea. And a lot of times eating to 80% full helps offset that. Nausea is a limiting factor. We're going to start you at a low dose and we'll slowly work up. Some do great and never have any side effects, any nausea, but some are just so sensitive even at the beginning doses that I start everybody slow and we can slowly work up if needed. Additionally, that allows us to kind of titrate to lowest effective dose, meaning I like to use the lowest effective dose of these medications to help curb your appetite enough to stay under your calorie goal, still get in your protein, but not wipe out your appetite completely, because I still want you to be able to eat. I want you to be able to recover from activity, exercise, get your nutrition in. And so we're just going to use them as an adjunct to help with your overall weight loss journey. Weight loss medication options. We have all heard of Ozempic these days, as it has really taken the media by storm over the last several years. Wegovy is the same as Ozempic and semaglutide is also the same. Those are all three the same medications. Ozempic is, my nose is itching terribly, so it's just going to do that. Okay. Ozempic is semaglutide for diabetics. That's what it was made for. They realized they had a lot of weight loss with it, and so they make Wegovy, which is for weight loss. They're both semaglutide, same medication. Same with tirzepatide. Tirzepatide is Mounjaro and Zepbound. Mounjaro is for diabetics. Zepbound is for weight loss. On average, after 66 weeks of use, semaglutide, the Wegovy study, they lost 13 to 15% of their body weight. Tirzepatide outperformed it in the Zepbound studies of the Surmount trial. Let me see. I don't want to say that. Yeah. The Surmount 1 trial, they lost on average 20.9% of their body weight after 72 weeks of use. And so these have been the mainstay of weight loss these days. But phentermine is another option. It's been around for a long time. Most people have trialed it. It can result in 3 to 5% weight loss, but typically I'm only using it for 3 months. It seems to do pretty well for about 12 weeks, and it just really seems to drop off in effectiveness. So phentermine, you can lose 3 to 5% body weight. If you add topiramate, which is another medication to it, it augments phentermine's results, and people seem to do better in overall weight loss with it. It seems to change taste and helps with cravings a little bit. Like it will make soda and alcohol taste flat. And so if you're really struggling with those, sometimes it'll help those be a little bit less desirable. Then you can take it a little longer than the 3 months, just like the phentermine seems to really fall off in effectiveness after 2 to 3 months. Adding the topiramate, you seem to get a little bit more out of it. And you can have up to, I've seen 8 to 10% body weight loss after about a year of use with that. Another medication is another combo medication of bupropion and naltrexone. This is the brand name Contrave. This can help with cravings, and it's about 5 to 8% of body weight loss after a year. It's a good adjunct to the GLP-1s, and it can be used as monotherapy, just as a single med prescribed. I just don't have tons of success with it. I typically have better response from the phentermine and topiramate if they can tolerate that, but this is an option. Orlistat is another medication, and it prevents fat absorption in your gut. It can add an additional 3% of weight loss a year. However, most people cannot tolerate it, as a side effect of it is oily stool. When it blocks fat absorption in your gut, it blocks fat absorption in your gut, and it just goes right through you. And so a lot of people can't tolerate it very well. I don't use it that much, but it is another option you could consider. Liraglutide was actually the original GLP-1, even way before Ozempic, and it is still a viable option for weight loss. It is just a daily injection, and so that kind of offsets a lot of people from wanting to use it, just because Ozempic or semaglutide or tirzepatide are once-a-week injections, so it's much less hassle to keep up with. Liraglutide, you can get 6 to 8% body weight loss after about a year. And it did just go generic this year, so it may be a more affordable option than brand name Ozempic in the future. So we'll just keep an eye on that. I hear a lot of concerns I have with GLP-1s are the loss of muscle mass with it. I don't worry about it too much if you are, one, prioritizing your protein, and two, getting resistance training in. Individuals that even just get 2 days a week of 30 to 40 minutes of resistance training can help maintain a lot of their muscle mass, and additionally if they're prioritizing protein. However, if you're using these medications to just wipe out your appetite, you're not worried about your protein, you're not worried about any type of resistance training, you may lose a significant amount of muscle mass with it. So we do not recommend starting these meds without, one, prioritizing protein, and two, getting resistance training at minimum 2 days a week. Even just walking 10 minutes after each meal may be a good place to start, in hopes that we can get you up to doing resistance training 2 days a week in the future. What does that mean? Either body weight exercises, resistance bands, weights, something that you enjoy that puts some stress and load on your muscles, joints, and tendons, and will help you maintain that muscle mass while on these medications. Sometimes I have guys who they're just like, they can't get the energy, the drive, the motivation to even start anything. without the testosterone on board. And so we get the testosterone on board, and it allows them to start an exercise regimen, to start eating better. And then they only have this positive snowball effect of now they have increased muscle mass, so they feel better, they're more confident, they're eating better, so they just feel better just from better nutrition choices. They're now sleeping better, so now they're recovering better. And it's just a positive snowball that needed the testosterone to start. Natural ways to boost testosterone without jumping straight to testosterone, which are good to even have a baseline if we start testosterone, is one, some sort of exercise regimen. 20 to 30 minutes a day of something where you get a little sweaty, a little out of breath, really goes a long way in just overall health and functionality. Cleaning up diet to where you're avoiding, high processed foods. You stick to more high protein, minimally processed foods. Typically the periphery of a grocery store are the ones that don't have the preservatives and are typically more one ingredient food choices, while limiting sugar and prioritizing protein. Sleep is something that is easily slept on and neglecting, just because sleep, it makes such a big difference in muscle recovery, cognition the next day. And so I really try to get 7 to 9 hours of restful sleep. And if we need to get a CPAP or even consider supplements or medications, and that's something that we can talk about as well. Mental health, controlling stress as best as possible and addressing your mental health is something that has to be addressed as well. If you need counseling or therapy, we can arrange that as well, just because it's a non-medication option that can start the positive snowball of making positive health choices. Really has to get your mental health in check at first. And then there's other little things like optimal vitamin D may help a little bit. Avoiding endocrine disrupting chemicals where you can, where you're cooking in glass instead of plastic. Avoiding as much chlorine in the water as you can, using more natural deodorant, shampoos, that kind of stuff. Those may make a little bit of a difference, and can maybe help boost testosterone level a little bit. Doing all of these, I don't see just super profound bumps in testosterone. I don't see people go from 250 to 750 on these. But, if you're doing all this, that may be what you needed to get symptom resolution rather than just jumping straight to testosterone. Again, I'm not going to withhold testosterone from somebody who's struggling to even start to get any of this. But if you can start, sometimes that's all it takes, is just to get that first little snowball going, and it compounds into just overall better lifestyle changes.